Hey everybody, I am officially finished with school and it seems surreal, but yesterday was my last day. We were leadership clinicals. We followed the wound care nurse around. She was explaining the facility that we were in. They have their own standards as far as bandages, type of medicine, and things of that nature that they use for their wounds to promote healing. So we got it really in depth and saw some really good wounds throughout this, actually just throughout the program and through this clinical. We also got to go with the infectious control nurse who taught us how to do a little investigating to find out, like especially have an antibiotic program. So on this antibiotic program, this is any resident that is prescribed an antibiotic. It has to be documented. Order have to be written. Doctor has to order it. Make sure if it's ordered, nurse the doctor has to sign off on the order. Also, it have to be put in a whole nother sheet. Everything needs to match up. They needs to know why the person is on an antibiotic. Follow up like certain tests, diagnostic tests that was done, like a CNS. It must be stated what on the CNS or the culture, the urinalysis that was sent in. It must specify like what organism it was. Things of that nature. So that was like really cool, really like looking through the charts and really understanding the charts and what's expected of us as a nurse to do. And documentation, one of the nurses just said in documentation, you can never document too much. You learn to get your own little system as far as like how to do your work. And LPNs don't delegate, but we do assign, and how to assign tasks to certain people, to your aides actually. So that was real cool. We went to the job fair on Wednesday. It was more like a little speed interviewing, just because the facility we work for has the school we attend has 17 facilities, and I think maybe 14 or 15 of the facilities were there, and mind you, it's 28 of us that will be graduating. So there's almost like 3 to a facility or a couple facilities, and it went pretty good. I think some of us are actually going to get hired as GPNs, and I'm excited about that. I'm happy for that. A lot of them are happy about that. So we had to go to their headquarters, so it was a nice little road trip. Some of us carpool, so we just talked about a lot of different things. We also followed the nurses around as they did their morning, not necessarily morning rounds, but as they passed their meds. We noticed some things that, by the book say it shouldn't be done. We noticed some things that, they do to make their day better. We noticed some things that are not supposed to be done but can be done. Book work and real work are 2 different things, but you have to be the determining person in that factor, for you, and going through trying to get this license. I can't say I'm not compromising it for anybody. I've lost too much time, too much sleep. I've lost my hair, even though it's growing back. I can never get the time back, but it's all going to be worth it in the end. I'm extremely exhausted, and it feels just weird and still surreal to know that next week is graduation. So once again, I say that I am totally stoked, and I made it through all the prayers, the inspiration, the encouragement, that I made it through this, and now on to studying for the NCLEX. So it's done. Oh, we did a lot of paperwork. We did a lot of auditing of the other charts, safety measures that they have, auditing the patient's rooms and things of that nature. Cleanliness, neatness, making sure certain things are where it's supposed to be, like if the exits are blocked and things of that nature, knowing where the exit are, knowing where their MDS records are, you know, understanding how to look in the chart, where to find information in the chart. So it was a good thing. So I am done. I am officially done as of July 22nd, 2011. I am so excited and I'm tired. So actually I'm about to get ready to go to work. So I just wanted to drop you all a few lines and say deuces, doing it LPN style, and thanks again. Bye.